This is Jeremy with CryoClarity, and in this video, we're going to be going over muscular identification of the gluteal region. To start, we have the biggest and probably the most known gluteal muscle, gluteus maximus. Since we have a gluteus maximus, we also have a gluteus minimus. However, gluteus maximus is the most superficial of the three gluteal muscles, whereas gluteus minimus is the deepest of the three. Therefore, the one in between is gluteus medius. So we have gluteus maximus, and since we have maximus, we have minimus, but the one in between them, since we have three gluteal muscles, is a gluteus medius. And therefore, deep to this gluteus medius muscle, we find that gluteus minimus. And inferior to this gluteus minimus muscle, which is the deepest of the three gluteal muscles, as gluteus maximus is the most superficial and gluteus medius is in between, we have the deep 6 external rotators of the hip. And the way we remember these is by the mnemonic, please send out information quickly. Please stands for piriformis, send stands for superior gemellus, out is obturator internus, and this is specifically the tendon of obturator internus. Information is inferior gemellus, and quickly is quadratus femoris. Quadratus femoris is kind of square shaped, hence quadratus, and it attaches to the femur, hence femoris. Our superior and inferior gemellus muscles are separated by the obturator internus, and the most superior muscle of the deep 6 external rotators of the hip is the piriformis. However, that still lies inferior to the gluteus minimus muscle, which is the deepest of the 3 gluteal muscles. What's unique is that the piriformis and the obturator internus muscles both have attachment sites on the internal aspect of the pelvis. Obturator internus attaches to the pelvic aspect of the obturator membrane, which lies within that obturator foramen, and the piriformis attaches to the anterior aspect of the sacrum, specifically on segments S2, 3, and 4, similar to this sacral plexus distribution that we see here. Obturator internus within the pelvis, piriformis within the pelvis, obturator internus outside of the pelvis, and piriformis outside of the pelvis. And those are just 2 of the 6 deep external rotators of the hip, with the others being the superior and inferior gemellus muscles, as well as quadratus femoris. And I know that these are only 5 of the deep external rotators of the hip, and I've been naming 5 even though I've been saying 6, but that 6th one is obturator externus, which we cannot see on this model.